BLS. What is BLS? What are the steps of BLS? Is it necessary to be a doctor or a medical professional to perform BLS? What are the steps of CPR? Does BLS include any kind of equipments? To answer all these questions, we are going to learn about the BLS, Basic Life Support. Hi, this is Sheikh Sadi from Clinical Department, DCDC Health Services. So, today we will discuss about how we can save a life using BLS. To answer your first question, what is BLS? We'll define it as BLS is Basic Life Support, which defines the series of procedures performed to restore the circulation of oxygenated blood after a sudden pulmonary or a cardiac arrest. So, let us discuss how using BLS techniques we can save a person's life. The victim can be found at hospital or mall or a railway station. BLS can be performed by any personnel who has learned about the BLS techniques. He can be a medical doctor or a medical professional, a housekeeping staff or a security guard. Performing CPR before arrival of emergency services can increase the chances of survival is due to the sudden cardiac arrest. Early resuscitation can result in the increase of survival chances. Now, in the next section, we will discuss about the patient to whom a BLS is to be given. And with the help of the video, we will discuss about the steps of BLS. So, as you can see in this clip, a medical doctor is taking a round of a patient where he found that the patient is unresponsive or something is wrong with the patient. The first step of the BLS is very crucial, that is the maintaining a scene safety. The one who is going to perform the BLS should make that scene safe for himself and the patient as well. As you can see in this video, the doctor is now checking the responsiveness of the patient by tapping on both shoulders. To assess the responsiveness, you can tap on both shoulders and ask if the patient is alright. As you can see, the patient is unresponsive in this case. So, the next step is the call for the help. There are two scenarios in this situation. When you are calling for a help, the patient can be in the hospital or the patient cannot be in the hospital. So, when you are in the hospital, you need to announce the code blue. And when you are not in the hospital, you need to call for the ambulance and you need to ask for the advanced cardiac life support. Now, it is markedly important to how to announce code blue. To announce the code blue, you need to call the rapid response team or the emergency team of your hospital. You need to mention the location of your patient where they need to arrive. After following the step call for the help, we need to move the next section. The next section includes the checking of the circulation of the patient. As you can see in this clip, the medical professional is performing the check of the circulation. You can count up to 10 seconds to check the circulation of the patient. The pulse that need to be checked for the circulation is the carotid artery. It is very important to save the time. Time is very crucial in performing BLS because with every minute the chances of survival decreases. As you can see, the professional is performing the check for the breathing as well. He is checking the chest uprise and down in the video. So, he mentions there is no breathing and there is no pulse. So, it's time to start the CPR. CPR is defined as cardiopulmonary resuscitation. That simply means the revival or the resuscitation of cardio means heart, the pulmonary means lungs. Now we will discuss the steps to be followed while doing the CPR. Now we will be following the right techniques of the CPR which can increase the chances of survival up to 60%. Now it's time to start the CPR. To start the CPR, place the patient in supine position on a firm and flat surface. Kneel down to the patient and locate for the position of chest compression. Now we will discuss about the point of compression where your hand should be placed. The point of compression is your mid-sternum. If you are confused about the mid-sternum, you can simply draw a line between the nipples, and where there is a point of intersection, you can start the CPR at that point. Do not compress at the lower sternum because below that there is a diaphragm. If it is damaged by the compression, it would be difficult to save the life. Firstly, you need to lock your fingers and place the heel of the one hand over the center of person's chest, the point we have just mentioned. Between the nipples, place your hand on the top of your first hand. Importantly, keep your elbows straight and position your shoulder directly above your hands. Use your upper body weight and do the CPR like the medical professional is doing in this video. Now as you can see, the medical professional is performing the CPR. He has put his body weight on patient's body and performing the compressions. The ratio of the compressions and the breathing is 30:2. That means after every 30 compressions, you need to give 2 breathings. As you can see, we have completed the 30 compressions in which he is using the Ambu Bag to give the mechanical ventilation. It is also called as jaw thrust maneuver. It is done to open the airway. So using right compression techniques and right airway techniques, we are giving 30:2 compressions in 5 cycles, which need to be done in 2 minutes. Now, after completing the 5 cycles of compression and breathing, we will check the carotid pulse again. If the pulse is present, then the patient is revived, and if the pulse is not there, there is another need to perform this CPR. Lot of people perform CPR, but what makes one to be a distinguished performer of a CPR? So now we will discuss about the components of high quality CPR. The components include, the first one is push hard. That means you need to give 100 to 120 compressions in a minute, which ultimately means you need to give 2 compressions in a second. Oh, it can be tough. Second component, push hard. That means the depth of the compression should be minimum 2 inches, that means 5 centimeter, and the maximum depth should be 2.4 inches, which is 6 centimeters ultimately. The third component is allow the chest for complete recoil. When you are giving the compression, allow your chest to come back to its original place before giving the another compression. The next important aspect is the minimum interruptions between compressions. So when you have left the compressions and going to give breathe and coming back again to start the compression, the time interval should be less than 10 seconds. It is important to maintain the graph of circulation because when you give the compression, the graph of circulation maintains, and when you leave the compression, the graph of circulation start falling. And the very last point is to avoid hyperventilation because the lungs have some vital capacity to accommodate the air. But when you are giving the excessive ventilation, the air flows out from the lungs to the abdominal tissues and to the lower organs of the body, which creates a resistance for the blood to circulate properly. We will discuss about the E and C technique to handle the Ambu Bag or mask ventilation. Place the mask on patient's face before attaching the bag. Using the non-dominant hand, create a C shape with the thumb and index finger over the top of the mask and apply gentle downward pressure. Hook the remaining fingers around the mandible, the lower jaw, and lift it upward towards the mask, creating the E, as you can see in the picture. Each rescue breath should last approximately for 1 second, and you need to watch for the chest rise while giving the breathing. Allow the time for air to expel from the patient. Now we will discuss about the AED. AED is Automated External Defibrillator. It is a device that has the ability to detect irregular heart rhythm, and it automatically delivers a defibrillation shock to stop irregular heartbeat, and it allows a normal rhythm to resume. Now we will discuss the components of AED. AED consists of electrodes and pads. It has 2 pads which need to be attached on the patient's body. The AED will itself guide you to attach the pads and the electrodes. After attaching the pads on patient's body, the AED will analyze the rhythm of the heart. Ask everyone or bystanders to stay away. Clear to make everyone clear from the patient body, and do not allow anyone to touch the patient's body. The AED will automatically ask you to deliver the shock, like in this video.
Call for help now. Remove all clothing from patient's chest. Pull red handle to open bag. Look at pictures on pads. Peel 1 pad off blue plastic. Apply pad to bare skin exactly as shown in the picture. Press pad firmly. Peel other pad off blue plastic. Apply pad to bare skin exactly as shown in the picture. Evaluating heart rhythm, stop compression. Susan, stand back. Stand by, stand clear. Everyone. Everyone clear. Do not touch patient, stand back. Shock delivered. Provide chest compressions and rescue breath.
Remember that CPR is an important measure to keep oxygen flowing to the vital organs until professional medical help arrives. The faster you initiate CPR, the better the chances of survival for the victim. BLS can be provided by trained medical personnel, including paramedics, and by anyone who knows how to do it, anywhere, immediately, without any other equipment. I hope this session will be helpful in answering your questions related to the basic life support. If you still have doubt or questions, you can ask in the comment box or directly contact to the clinical department of DCDC Kidney Care. Thank you.